get started. So first thing I want to do is I'm going to go over the chapter 2 case study. So if you haven't handed it in by now, then I'm going to have to give you a 0 because we're going to go over the answers because it was due by class time. We'll go over the chapter 2 case. Oh, did we go over the quiz? We didn't go over the quiz yet. That's because there's still somebody who didn't take it because they had to take it right after class. Okay, so we'll start with the chapter 2 case study, and then we'll hit chapter 1 quiz, I guess, on Monday, or I don't know, if you guys have any questions about it. I guess, I should have thought about that. I should have made sure that they took the quiz before this. Anyway, sorry, I didn't. We'll figure it out, but we'll review it. I did review that with my other class, and it just enabled us to kind of like go over a couple things. There was like a couple questions that came up. So we will do that, okay? So remind me if, we're not gonna meet live on Monday. All right, well, anyway, remind me about it. Maybe when we go over, so next Wednesday, you guys are gonna be taking a quiz on chapter 2 and 3. So probably I'll just then go over chapter 1 as well. Sometimes it's better like that anyway, because then we had a little bit of time away from that chapter, right? And then we can go over it again. So let me share my screen, guys, and then we'll go from there. So sorry, I forgot about that. Okay. I am not in your course. Let me go back to your course and let me just remind you of a few things, and then we'll go over that chapter 2 case study. And then there's another case study that I'm going to go over in chapter 2. And then I also am going to show you guys some review questions, or go over the review questions for chapter 2 that are in the textbook, because they are worded in a way that the exam questions are worded. You can also access them directly from your book. The answers to those questions are in the back of the book, but if you have the e-version of the textbook in the MyLab, it's interactive, and I'll show you that because I'm going to access it through that way. So again, it may be a good investment to have that MyLab subscription, because there are even extra NCLEX style questions that they supply there in addition to the review questions as well, okay? Also, moving forward, I may start assigning some homework questions, basically those review questions. The only problem is that those, I don't know if I'll really assign them. Maybe, but the answers are in the back of the book, so it's kind of stupid to do it as an assignment. But I want to make sure you guys have access to those questions, put it that way. So we will do it in class, but even if for some reason we miss a chapter or something like that, I want to make sure you guys still have access to those. So I'll probably somehow put them up on Moodle. I'm just kind of debating what the best way is to go about that, okay? So you'll know what I'm talking about once we start going over those review questions.
Have you decided if we're going to do in-person classes or online?
Yes, so on Wednesdays, so starting next week on Wednesdays, we will meet in person. Monday, we probably won't even meet live at all. I'll let you guys know about that, but I'll send you either an email on Sunday night or Monday, and just remind you that I just put up a recording, or to do this assignment or something like that, add something to the discussion board. So just know that we won't meet live via Zoom on Monday, but there will still be some sort of assignment that you're going to need to complete, but you'll be able to do that on your own time Monday. Okay. But yes, next week, starting Wednesday, on Wednesdays, we'll meet in person. So we're going to start it that way, that Wednesday we'll meet in person. We'll still keep Monday as a virtual day, because remember, if we're taking exams, they're going to need to be delivered remotely. It doesn't make sense for students to be sitting in the classroom while other students are sitting at home, and doing the exam. So I'm just trying to level the playing field in that sense. So for right now, I'm going to keep it as Monday being virtual day and Wednesday being in person. That may change. So let's kind of see how this works in terms of the in-person, and then I'll may just add Monday again as an option for those of you who want to be in person. Okay. I will still email you guys to confirm, again, as long as everything's moving the way it should, and also the room number that we're going to meet in. So I believe, what's on self-serve isn't necessarily accurate in terms of our meeting room. Also, what's on self-serve, I believe right now, is not big enough to hold all of those of you that want to be in person, okay? So I'll get back to you where we're going to be meeting, but plan on Wednesday on meeting in person, okay? If you want to be in person, obviously, remember, you have the choice. Also, with that said, if I set up these in-person meetings and, half of you that say you want to be in person are showing up, it's going to go back to all virtual. I mean, that's, again, not fair to me. So if you're going to say you're going to be in person, then everyone who says they're going to be in person better be showing up for those meetings. Okay. So like I said, we'll start off with that and then we'll see how that goes. And if everything's going well, then likely I'll add, that Monday and Wednesday we'll have the option of being in person as well. Okay. So for now, we'll leave it as Wednesdays. Your exam 1 will be scheduled for a Monday. I believe we have it. So I'll tell you right now what it's scheduled for. So the week of September 14th is September 14th, a Monday. That's when your first exam will be. Okay. I just wanted to check that date is accurate. Yep. Okay. So let me do that right now. I'm going to add that it's on Monday so that you guys know and that it's there just to remind you. Any other questions, guys, as we're kind of, and I do have to make edits and like add things to the weeks down the line. So I think maybe I only told this to my freshmen, but best just to stay within the weeks that we're at. I mean, in fact, in the course that I teach at Kane, on their Blackboard, we hide all of the future weeks and really just show the current week. So don't get, I mean, sometimes you end up getting yourself overwhelmed anyway. So just focus on what you need to in that given week. So let me just write that down, guys. Monday, September 14th, just to make sure that we're all aware. And then we will start chapter 5 that Wednesday. Okay. Start talking about chapter 5. All right. There was also something else that I wanted to add here too, just a reminder. So if you look here, there's a chapter. What the heck happened? Oh, here. A chapter 2-3 quiz that will also be on oh, wait a second. I'll double check that. I got to go look back. But you're going to have a quiz on chapters 2 and 3. And it will probably be right at the beginning of a class on Wednesday. Yeah. So that's Wednesday. Let me check the date. I'm going to write that up there right now, guys, so that you guys know that. I put that on my other site and I forgot to add it here. So Wednesday the 9th, okay, we'll have a quiz on chapters 2 and 3 right at the beginning of class. So those of you that are going to be in person in class, you'll log on to Moodle and take it there. Those of you that are remote will be doing it remotely, but we'll do it right at the beginning of class again, okay? All right, so I think that kind of is everything for the updates. I'll make that bigger. All right. That's not big at all. Okay. All right, guys, any questions? Yeah, I gotta fix that. That's okay. All right, so again, reminders, right? We'll go over that chapter 1 quiz when we go over chapter 2-3 quiz. Okay. So then that'll we'll have our basically sort of complete review up to chapter 4 at that point. So again, remember that your exam is scheduled for that Monday. So we're going to be we're finishing chapter 3 this week. I'm going to put that up by Friday. Chapter 3, like I told you before, is really not that dense. It's not anywhere near what chapter 2 is like. And then I'll add chapter 4. So you'll have chapter 4 there by Monday. So both chapters 3 and 4 will be uploaded, those recorded lectures, so that you'll have that entire week to go over that material. And we'll go over that as well more on Wednesday. Okay. So that's the story. I wanted everyone to kind of know the dates here of everything. Any questions, guys? All right. So let's go over the case study that I assigned to you guys. Hopefully everyone submitted it. If you didn't, I'm sorry. Like I said, I'm going to have to give you 0 because we are going over the answers. So you guys can see if you miss an assignment or you miss a quiz, it sort of, it really throws off the whole flow of the class. So just be forewarned. All right. So I'm not going to click on it this way. I actually have it here. Nope. Yeah, right here. Okay. And also there's other case studies in there as well. So if you look at that folder that says chapter 2, or it says unit 1 case studies, and then it's broken down by chapter, all of the chapter 2 case studies are in there. Okay. It is a good idea to review these case studies, even the extra ones that I might not assign. Okay. Because they bring up concepts from the text, and maybe it's a concept that we didn't, maybe I didn't spend a ton of time talking about, because again, I can only say so much within the lecture, but it brings up some of these other important concepts. The other thing I wanted to tell you, on the exam, I may very well kind of use one of these case studies, or use a case study where I give you some background information and then ask you questions about it. Again, not about memorizing things, but understanding. Okay, so similar to the way these questions are asked, I could even use some of the same questions from some of these other case studies. Okay, so again, good idea to take a look at these. So I assigned not this one. Okay, so this one here. All right, so take a minute, I guess, to read this and sort of refresh your memory about this case study, and then we're going to talk about what you guys wrote down for your answers. Okay, I'll remind myself as well. Okay, so does somebody want to tell me, I mean, the first question is super straightforward, right? In terms of what is epigenetics. So what did you guys write down for that? Somebody tell me.
I said it involves inherited changes to DNA and molecules. It's not a change in the sequence or the nucleotide, but it's about changes that affect the gene expression.
Good, perfect. That's a really good definition. Okay, so like I said, this is a super straightforward kind of question, but obviously, so I guess I'll ask this now. So why do you think they asked this question as question number 1 as it pertains to this introduction here? Kind of says it. I mean, here. What's meant by this sentence, I guess? She saw a brief report on the news about reducing her baby's genetic risk through an epigenetic approach. Why would it be described that way, I guess?
Because they don't want to change her original gene expression. They just want to modify the smaller allogene input of it.
Yeah, well, there's no way of altering the gene sequence. I mean, I shouldn't say that. There are, I mean, if we're talking about like in vitro and stuff like that, perhaps there's ways of altering actual genes, right, with some of the technology we have. But we're talking about kind of the mom taking fish oil, right? So the idea, and I talked about this in the recorded lecture, the idea is that there are chemicals or molecules that potentially could manipulate epigenetic types of mechanisms, right? That then possibly could affect the expression of like inflammatory genes. So that's kind of the idea here. The idea is that it's saying through epigenetic approach, meaning if you take the fish oil, it then might affect some of these epigenetic factors that then could affect the expression of these inflammatory genes. Does that make sense? Okay, so again, I wanted you to kind of think about that connection of the fish oil per se, I guess, to the epigenetic changes. All right, so if we move on to number 2, what advice might the genetic counselor give Ms. Vasquez about news reports of genetic breakthroughs? What'd you write for this?
Excuse me. They might advise her to do like more research into the subject, because sometimes the news, they don't accurately report everything. So she would want to do more research in order to be more careful, like do like, I guess, some medical research, read some articles, some more reliable sources.
Okay, good suggestion, right? Again, it shows that you could sort of, right, we're understanding that what you hear on the news is not necessarily reliable. However, do you think that a patient would be able to read or understand like a medical journal, right? Similar to like the journal article that we read. And is it really, would we really want to refer them to something like that? What do you think? Rather than refer the patient maybe to read those, what do you think might be maybe a better, and again, there may be some patients that you know maybe have a medical background and that may work, but what about somebody who really has no kind of background knowledge about science or medicine? What might be a better?
Maybe talk to her doctor, her gynecologist, or whoever she's seeing while she's pregnant,
Yeah.
to get more of a layman's term for everything.
Good. Or the genetics counselor, whatever medical professional we're talking about, probably, you know, whether it's you as a nurse or whatever, you're the one who has to put that information in layman's terms, right? So it's more kind of about that. It's about explaining, yeah, this stuff might not be reliable. Right. Maybe ask your doctor or ask me, and we can maybe give you some better information. Right. So anything along those lines obviously would answer the question. Yeah. So if I look at like what the book put as their answer, obviously multiple answers would suffice here. It says Ms. Vasquez should be instructed to speak with her genetic counselor before making any dietary changes based on news reports. That's the idea, right? Or speak to her doctor, whatever. Okay. All right. I'm sure we all kind of got that. That goes along with the sort of evidence-based, right? Goes along a little bit with evidence-based research, but again, remember that's sort of the job of the clinician, not really the job of the patient. Okay. All right. Now, next question. Oops. Okay, so just take a minute just to read that paragraph there, although it's not really anything new than what the first one told you, I think. Oh, so that is a little bit different. All right, so for number 1 there, how'd you answer that?
I basically said that I had to look up pharmacogenetics because I forgot what it meant. But,
Okay.
That it was because people respond differently to certain drugs, and the plasticity of epigenetics, that the fish oil may or may not help reduce the baby's reactions or allergic reactions, or stop them altogether from kind of actually seeing that expressed.
Okay, good. What else? What's another way that somebody answered that question, I guess?
I answered similar, and then I also said, because when I read in the textbook, it said studying this will allow people to receive like a personalized prescription. So then I went more into talking about like omega-3 fatty acids and how it could, like, you know, help with the baby not inheriting her allergies if she alters her diet and like looks into it more.
Yeah, and the idea is that, but the idea is potentially, or understanding the fact that depending on your genetic makeup, right, or genetics may alter, like who was the first person to answer that? I didn't even see you on the, my little screen is small.
I think that was me. I had my camera off at first because my sister was going in and out of my room. Sorry.
All right, tell me, who was it? Tell me your name.
Hannah.
Okay, Hannah, gotcha. Right? Like you said, it's the idea that you would have a different response to a medication or a supplement based on your genetics, right? And so there could be some information out there that could predict how or what the response might be, right? There could be, okay? I mean, that's kind of, again, this is sort of the way that we're trying to kind of go with science and medicine, is to really use genetics to inform us about the effectiveness of drugs. Also, potentially, things could potentially be harmful, right? So there could be some sort of genetic marker that you could find, or genetic change, you know, that we can test for, that says that this drug, if you take it, may be harmful to you. So you can kind of think about it, the flip side as well. I use the example, I believe in the recorded lecture about certain type of anesthesia. So there's like a known, I don't know if you would technically consider it an allergy or whatever, but there's a known, you know, sort of genetic marker or a genetic change that you can get a genetic test for that will pinpoint to say, yes, either you have that genetic change or you don't, that will make, or that would make you more susceptible to a negative sort of response to anesthesia. And maybe you can end up going into like respiratory failure or something like that, right? So it could have a negative consequence. Also, maybe a certain type of anesthesia might not be as effective on you, okay? So this isn't something that's like some like thing that's like in the future or whatever. Like this is now, okay? In fact, if you look at number 4, it says what resources available to provide pharmacogenetic information. What'd you guys write down for that? Or did anyone kind of research that further? What'd you find? What resource would you, I don't know.
I typed it in, I typed in the, and I found out that the cdc.gov, they have some information, like some other sources they refer you to find some more information on it.
Okay. What else? What are some other things that people wrote down for that question?
I said you would just get like a referral from like your primary care provider. And then
To
like see like a specialist in that.
Okay, and what would that specialist be? I mean, I guess it probably would be a genetics counselor that focuses in on sort of genetics of drug responses, I guess. Yeah, most likely. So I don't know that there's a specific medical professional that fits exactly into that role, right? It could be a genetics counselor. It could also just be your doctor might just have some more knowledge about that too. Apparently, the FDA also maintains a list of approved drugs for which there is genetic information about. Meaning like, all right, let me check that. So check fish oil, and you could see if there's more information about, is there a genetic, do they have information on sort of genetic changes that might impact the effects of fish oil, right? Or anesthesia, like the example I gave before. I mean, can you guys think of another example as to why this type of information would be important to know? We talk about like personalized medicine, right? What do we mean by that? And how can we use this information, I guess? Beyond the scope of this one case study.
Well, let's say you have cancer or something, maybe there are like, I don't know, better treatments that's more tailored to your genetics, I guess, and the doctor can, instead of like doing trials and errors, they can find that specific medication and use that for your first treatment, so you can have a better chance of recovering.
Yep, exactly. I was thinking of that, right? So there is a lot of, so yeah, if you think about chemotherapeutic agents or other cancer treatments where there will be genetic information with that. I mean, when we think about personalized medicine, usually you probably think about cancer treatment as one of those fields that there's a lot of research going on kind of just along those lines that you just mentioned. What about something like negative, I guess? I don't know. Can somebody think of another example?
Did you say negative?
Yeah, maybe like yeah.
I don't know if this is what you're looking for, but I feel like with some things, like you don't know how the patient reacts until they have a negative reaction. Yeah. So like you said with like anesthesia, like if they, like sometimes they can become extremely hypothermic and sometimes you don't know that happens until it happens.
Right.
So it's kind of like trial and error, I guess. Like, yeah, I don't know if that makes sense.
No, that makes sense. That definitely makes sense. And that's the thing. It's like, if we can know that information ahead of time, obviously we can prevent those things, right, from happening. We don't have to use trial and error. Yeah. Right. That's a kind of more of a negative impact. What about, even if you think about, I don't know if that FDA, oh no, it says approved drugs, but if you think about like illegal drugs, right? Like if you think about like overdoses and stuff like that, I don't know if there is any genetic information on that, but I mean, obviously it's too late after you OD'd or whatever, but perhaps there are genetic factors that impact, you know, how sensitive you are, say, to an opiate or something like that. I'm sure there are genetic factors, put it that way. I just don't know how much information is out there on that, but you can even think of it in that sense too. All right. So again, the whole reason why we go through these case studies is because it brings up a whole bunch of different topics, right? We talked about epigenetics. We then talked about pharmacogenetics. And then also we mentioned personalized medicine. So all of these things were mentioned in the chapter, but again, you know, in a given lecture, I don't have time to go through every single kind of example. And so that's why these are super helpful to sort of supplement, you know, what we learn in class. The other thing I want to mention too, like, look, if I don't cover something in the lecture, it won't be something that I would ask you on the exam, but that's not all it's about, right? I mean, you guys are here to learn as much as you can about pathophysiology. So just know that there is so much information out there. And some of it you're going to have to try to seek out yourself. But, you know, in terms of being, you know, fair in the way I'm going to deliver or give you guys questions in the exams, it's always the things that I sort of emphasize and that I covered. Okay. If for some reason there is a question that like it seems like I didn't cover, I always then would give you guys back the points or something like that. Okay. But so again, but that's not what it's about. It's about having this knowledge, right? And really learning as much as you can if you want to, right? Okay. So what I want to do next is I'm going to show you, I guess I'll do it this way. This is another case study. Okay. That's in chapter 2. I didn't necessarily assign it to you. Like I said, it's there. So it's in the folder, it's in your textbook. But if you guys take a look at this, so kind of what I just said, sort of this reminded me about this. So just take a minute to read this. Oh my goodness, my TV's so loud, I just realized.
Mrs. Kaminsky,
Yeah, what's up?
would you ever post the answers to the other case studies if we don't submit them? Like,
Yeah.
you know, extra ones for practice?
Yeah, I mean, I could, and probably I will. I probably just put all of the answers to the case studies maybe in just like a separate, in a separate folder, or I'll put it in, let me see how I want to do that. Because again, I kind of can just, I can definitely do that. And in fact, I was thinking about doing that anyway for you guys.
Okay, thank you.
Yep.
I also have a question about the case studies. So are you going to give us a grade on the way that we answered it, or do we just get credit for submitting it?
So for the case studies usually it's kind of just like, as long as you answered it, in a relatively reasonable way, I give you all the points, right? However, there's many cases where people might copy paste something, or they copy whatever, or they just wrote like one word answer and they didn't really even think about the question. So if it's sort of clear that that's what's going on, then I probably would take points off. But if you got, you were thinking about it, but maybe you just didn't get it quite right, I'm not going to take off points for that. Yeah, these are kind of hard to grade. I think it's more about, that did you actually read the question, think about it, and try to answer it as best you can. Yeah. So for the most part, you get credit for answering it. Okay. But that's why then we go over the questions together, and then I have the answers posted, or I'll unhide them already for this case study on Moodle. But yes, I'll put up all the other case studies as well. Okay. Because again, I think it's helpful for you guys to go through these. And like I said, on the exam, I may use it like as an essay question, give you one of these scenarios and ask you some of the questions, maybe different questions that I might come up with, or even some of the same questions that are here. So that's the only issue with putting up all of the answers if I'm planning on using some of these. So I have to think about how I'm going to do that. Okay. All right. So did you guys have enough time to read this? So what's the disorder we're talking about here? This neurofibromatosis, or NF1. Not necessarily. I didn't specifically really mention this disorder in the lecture. It's in the textbook. So this is an example of something that maybe I didn't emphasize, but again, I can't go through every single example of a genetic disease, right? I just kind of gave you guys some examples. So I guess I just wanted to kind of use this as, I guess I would, if I didn't go over this, I wouldn't probably be asking you a straight multiple choice question maybe about it. Now we are going over it, but there's lots of extra information kind of just, kind of feeding into kind of what we can present in a one semester course. So just kind of putting that out there. So if you guys look at this here, I think number 1 is pretty easy to answer. What would you put, what would be your answer to number 1 there? I mean, what's the whole topic of chapter 2?
Would it be genetics?
Yeah, it's just genetics, right? So it says here, Mr. Bauer states that while he does not have similar skin markings, he could not have a diagnosis of NF1 because he does not have all the other clinical features seen in his son. So what do you think about that statement there and then? Is that true? Or how would you, if he said that to you, what as a geneticist or as a clinician, how would you respond to that?
But he might not have the allele, but he might have one of them, not just both of them.
Yeah, and remember, I talked about kind of things like there's terms called like reduced penetrance and variable expressivity. The idea being, that even though these are, this is a genetic disorder, it presents itself very different in different patients, right? And so you have less severe and more severe cases. And so this is an example of this. So Mr. Barrows very well may have this disorder, right? But he maybe really never even knew he had it because his symptoms were so mild, right? But now he's seeing these types of symptoms in his son, and likely, right, he may have it, or there's probably more of a family history involved, right? So that's kind of the idea here. So let me just see, what are questions 3 or 4 here? I kind of already mentioned this, I think. Right, so it says, how does variable expressivity explain Mr. Barrow's confusion about not having the same clinical features as his son? Right, so think about how you would, I kind of sort of already explained that, but how you would explain that, right? So what do you think the geneticist or the clinician is going to recommend at this point? You think he's just going to tell Mr. Bowers, oh, don't worry about it? You don't really have any symptoms, who cares?
I would think he would then also try and recommend testing for it in the dad.
Yeah, right, to know if he has it, because the idea is because you can have more severe symptoms, right? And so the idea is you would want to know, if you can predict something like this, you would want to know, right? I mean, how much that's gonna, change, like if you're gonna have more offspring for something like this, maybe not. But if you think about something, that again might have more serious symptoms or clinical features, it may change that, right? So knowing this information is probably important. Oh my goodness, sorry. What are you doing, Cole? She just pulled my plug out. Go. All right, so I want to just show you something else. So the reason why I sort of brought this up is I was going through these review questions. Okay, so through the e-text, go away, 1 second. Okay, so if you paid for the MyLab version, you have access to all this here. If you look at the enhanced e-text, so I just wanted to show you that this is a resource that you guys can purchase. It's going, I think. Maybe not. What's this doing? 1 second. I don't know what I did here. it might be that I have to log back in, but let's see. 1 second. I don't know what this is doing. I think it's loading now. Yeah. Oy. Yeah, that's why I have to log back in. Sorry, I was logged in, but it logged me out without me knowing. So annoying. All right, let's go back over. What happened to my menu? Oh, this got me all screwed up now here. Hey. Okay, so if you have the eText version of this, you can access review questions right from here. These are the same review questions that are at the end of the chapter in the regular textbook. I told you the answers to those questions are also in the back of the book. If you access them this way, though, it's completely sort of interactive. Okay, so we're going to go through a couple of them just to, again, review chapter 2 a little bit more. The other thing, yeah, I guess we can just start there. So let me just click on those. Okay. So, like I said, I was looking at these review questions, and then that sort of brought up this neurofibromatosis, and then fibromatosis, and then I realized I didn't really talk about that much, right? So if we look at this question here, tell me what you think the correct answer is. This is the way a lot of the exam questions are worded. What do you think?
I don't know if this is right, but is it the last one? I can't pass this disorder on.
Probably, right? So if you click on this, again, and then it's going to give you feedback and explain why that's the correct answer. If you answer it wrong, it'll give you a chance to answer it again. But yeah, so it says, you know, I can't pass this disorder on to my children, okay? So we should know that neurofibromatosis is a genetic disorder, particularly an autosomal dominant disorder, okay? If it's a genetic disorder, the patient certainly can pass that on to my children, right? Or to their children, okay? So again, this is this term variable expressivity, right? You get this really large variation in the clinical manifestations, okay? And so sometimes there's a lot of people that may not think they have the disease, but they do, or the disorder, right? So it's saying here, there's different forms, some mild forms. A person may only have a few of these cafe au lait spots. So if you guys look here, it's just some sort of mild pigmentation that you see, okay? But as you get into more severe cases, okay, there are, you can have neurofibromas, which are actually tumors, they're benign, of the nerves, okay? So again, there's a variation in that. So anyway, I wanted to make sure I sort of brought that up and just remind you that you have these extra resources through the eText, through the regular textbook. I will probably go through, or each time we're going to review, I'll pull up these review questions. These are very similar to the way that the questions are asked on the exam, okay? The multiple choice questions. So let's do another one. Okay. What do we think about this? Somebody who hasn't answered yet, answer. What do you think the correct answer is? It's okay if you're wrong. Don't make me call on somebody.
I'm gonna go with the first one. I'm not sure if that's right, but I'm just gonna go with the first.
All right. Who else agrees?
Me.
All right. I agree. Yeah. So when we say aneuploidy, so euploidy is the correct number. Aneuploidy means incorrect number. Okay. So incorrect number of chromosomes. So there's an abnormal or incorrect number. And so there you go. And so what does that mean? I mean, we talked about some diseases that are associated with an incorrect number of chromosomes, right? Remember, if we talk about Down syndrome, it's a trisomy of chromosome 21. So when we say trisomy, we mean 3 copies of chromosome 21 instead of 2, okay? I think I also mentioned things like Klinefelter-Turner syndrome. Those affect the sex chromosomes rather than the autosomes. All right, let's do another one. Okay, I will tell you right off the bat, okay, that the way this is worded, or the use of carrier to describe an autosomal dominant sort of disease or mutation is a little weird, but just read it and see what you guys think, and then we'll go through it together. Oops. So what do we mean by, if we're saying, so it says the pregnant woman is a carrier of an autosomal dominant gene mutation. So let's consider it as like an autosomal dominant disease, right? So if we're thinking about that, what's her genotype? If we're saying she's a carrier.
It would be like uppercase letter and lowercase letter, right? Something
Right.
like that.
Right. What do we call that?
Heterozygous.
Right, heterozygous. So the reason why I say I don't like the term carrier, usually, you know, when you say carrier, you're talking about an autosomal recessive disease, saying, you know, this patient does not have the disease, but they carry the diseased allele, okay? So like I said, I don't really like the way that this is worded, but if you take it kind of for what it is and you see carrier, then essentially it's going to mean you're heterozygous, okay? All right, so if we say that this is an autosomal dominant disease, this patient with this heterozygous genotype, do they have the disease or don't they? Yes, they have the disease, or no, they don't. This genotype, autosomal dominant disease.
No.
Why do you say no? So remember, we talk about, like, we're showing the genotype here. Remember, these are 2 different alleles. They're essentially different versions of the gene, right? So, and we're talking about a specific disease. So the capital C allele, the dominant allele, is the diseased allele, right? The little c is the normal allele, or the normal version of the gene, okay? So with that information, what do you think? Do they have the disease? Yes or no? It means autosomal dominant disease.
They do have it.
Mm-hmm. They do. If this was an autosomal recessive disease, that would mean that the lowercase allele, the recessive allele, is the diseased allele. In that case, does this patient have the disease? Yes or no, if we're talking about autosomal recessive? No. Okay. All right, so let's go further with this. It says, which of the following would the nurse explain to the woman and her partner? So it says her partner does not carry the gene. So that means, what if we said the diseased allele is the big C, what would be the genotype of their partner if we said they don't have that big C allele? What's their genotype? What is it?
The partner would be homozygous recessive.
Correct, homozygous recessive, little c, little c. Okay. Now it says, which of the following would the nurse explain to the woman and her partner?
Would it be like the second one, there'd be a 25% chance?
Why?
Because,
how do you figure that out?
Because I know, like, when you do like the little chart, it would be like the big C, little c, and then the 2 little c's on the side.
Mm-hmm.
And then there would just be, like, in one box, it would just be 1 big C and 1 little c, and the rest it would be like, oh no, wait, hold on.
In one box.
I was wrong. It was probably 50%. Yeah, I was wrong.
Right, so do the Punnett square, right? So here's the female, right? She's the carrier. Here's her partner's genotype, right? The 2 little c's. And now you draw out the possible offspring, right? The possible genotypes for the offspring. So here's the first one, big C, little c. And again, I go through this in the recorded lecture, like like for a long time. And then here, what would I put here?
The 2 lowercase c's.
Thank you. And then what about over here?
The 2 lowercase c's again.
Okay. All right. So now if you think about the chances here, right? It says, what's the chance that they'll have the disease? Which one of these genotypes have the disease, these possible genotypes? This one and this one. Do you guys agree? Because we're talking about that autosomal dominant. Yeah. And these two do not, right? So what's the chance of the offspring having the disease?
It's a 50% chance.
Yep. 50% chance. Okay. So if you have no idea what I'm talking about right now, you need to listen to that recorded lecture. Maybe you need to listen to it 2 times. And then if you still have questions, let me know. And, you know, I can go over it with you individually, but this is basic genetics. And I know, you know, like, I don't expect you guys to like be experts in genetics. We have 1 chapter on genetics, right? But I think we should be familiar with this, okay? What it means if we're autosomal dominant versus autosomal recessive, okay? Does anyone want me to go over anything more? I gotta erase this, I just realized.
If it was recessive, would it still be 50%?
Actually, in this case, yes. Correct. Because these 2 wouldn't have the disease and these 2 would. Good question. All right, let's move on. What happened to my little here? I gotta erase my scribble. Otherwise, we're not gonna be able to read the next question. Any other questions, guys? No, we're all right now? Okay, let's do another one. All right, so this one kind of brings up a few kind of points here. So it says genetic testing indicates that one partner has an X-linked disease. What does it mean to be an X-linked disease? What does that mean? Somebody tell me that.
I'm assuming it has to do with the chromosome, so the disease would have to do with a person having the X chromosome.
Correct. The gene for that disease is on the X chromosome. Yes. Okay. So it says the nurse explains that a son will manifest the disease. A daughter can receive the disease only from her mother. A daughter will have a more severe form of the disease. A son will inherit the disease from his father. Which one would you choose here? There's a couple things going on because you have to also think about if you think about a son or where you're inheriting what. So if you think about a boy, a son, right? He's going to inherit the Y chromosome from his father. Okay. So only the Y chromosome would come from the father. So it says a son will inherit the disease from his father. No, because from his father, a son will get the Y chromosome, not the X. Right. So it can't be that one.
Would it be the third one?
Why?
Because if you said a son would receive the Y chromosome from the father, I'm believing that the daughter would receive the X from the father too.
Well, but that doesn't have anything to do with the severity of the disease, right? So I guess here we're thinking about would a girl have a more severe form of an X-linked disease?
I think it's A, because it said female carriers can have the disease, but they will have milder symptoms than male.
Correct. Because why? Females have 2 X chromosomes, right? And so if you have this sort of diseased allele on one X chromosome, the other one might have the normal allele. Even though, I mean, you can see here, I have this up here, this X inactivation. Just don't worry about stuff like that right now, okay? But one of the X chromosomes in females is a lot of it is usually inactivated. However, if you think about X-linked diseases, there's the idea, the reason why females don't really express these diseases is because they have one normal allele. So if that whole X chromosome was completely inactivated, this wouldn't happen. So don't even just if you're thinking about that and you want to talk more about it, you can, but it'll probably just go down a path that'll end up confusing people. So I just want to throw that out there. But the idea is here, right? Because females have 2 copies of that X chromosome. Usually females won't manifest the disease, okay? So it's the son that will manifest the disease, okay? Because that X chromosome, that one X chromosome that the male has would be that disease allele, and then the Y chromosome, that gene doesn't exist on, okay? So that's what we mean by X-linked. It's only on the X chromosome. So if you only have 1 copy of it, you're gonna manifest the disease. By the way, I wouldn't put a question like this on the exam because it's a little confusing, okay? And there's like a lot of moving parts to this question. So, or if I did put something like it, I would make sure the answer choices were a little more clear, okay? Just so you know. But again, these are questions, and questions like this can show up on certification exams like the NCLEX. I mean, it's always about kind of applying a whole bunch of different concepts kind of into this one question, right? It seems like a simple question, but there's a lot of things you need to know to get it right, all right? So, but just know for the exam, I wouldn't ask you a sort of a question like this because there's probably too many moving parts for us at this point, okay? Questions about this, guys? All right. So if you if you think about a son, you think about a male, they're getting the X chromosome from their mother, the Y chromosome from their father. So if that diseased allele existed on the father's X chromosome, there's no way he can pass it down to the female. I mean to the son. Sorry, I'll shut up because I'm gonna confuse everyone. Moving on. The genetic counselor is explaining pre-implantation genetic diagnosis to a couple. Which of the following does the counselor tell the couple? I don't know how much I talked about this, right? So again, I wouldn't probably put a question like this on the exam if I didn't really cover it, but right, something that might show up somewhere else. So it says pre-implantation, right?
Would it be the last one? Oh.
What do you think? I mean, again, this is like I didn't really cover this that much. What else? What do you think? What's our next choice?
The third one.
First one?
The first one, yeah.
Oh, wait, it makes me try again. Okay, so screening embryos that are produced through in vitro fertilization, because the idea is, again, before that then gets implanted, we would want to make sure that there are no genetic abnormalities, right? So again, I don't know that I specifically really talked about this in depth, and so I wouldn't include something like this on your exam, okay? So again, I'm super fair on the exams, but again, these are things that are all applicable to to genetics, right? All right. All right, so here we go. This is kind of like us going along with kind of what we did similar before, right? But now we're saying both parents are carriers. So what are both parents' genotypes here?
Heterozygous.
Yep. So we got, why does it take so long? Why can't it just choose that anyway? Okay, so both are heterozygous, right? So if we fill out that Punnett square, what is the percentage of offspring that will have this disease? Autosomal recessive. So this is big C, big C. These are both heterozygous, and then this is homozygous recessive. What is it?
You want to be 25% have the disease, and then 50%
Correct.
carriers.
Yep. So it asks you which of the following statements made by the parent indicates. Okay, what does it say? Oh, yeah. Okay. So sorry. So this is asking about who's going to have the disease, right? So yeah. So here it's 1 out of 4, right, or 25%. Do you guys all agree to that? I hope. What's this doing? Okay. So there you go. So we kind of went through that example. Well, no, I guess we'd had different genotypes for the parents, but same. We went through the autosomal recessive concept. All right. We might as well do them all, I guess. The nurse is teaching two parents who are both carriers. Here we go again. All right. What did we just do? What do
Punnett
you call
square.
it?
Punnett square.
Yep. All right, good. All right, so last one here. Wait, it's again an X-linked disorder. I feel like they could have expanded on some of the other concepts that are in the chapter. Almost, not yet. What do you think, guys? What would you choose here?
A.
Mm-hmm. A is definitely the best answer. Right, and I mentioned this sort of inactivation, X chromosome inactivation. In the reality is that most or females mostly use one X chromosome, and it's sort of random as to which one it is. And there's a lot we don't know about it, but that's the idea. If we go back, let me just kind of go back to those other answers. What happened? Why didn't it go back? Wait. Oops, that's not what I wanted to do. Anyway, sorry. Let's see. It's gonna make us answer all these again. Why doesn't, let me see if it just lets it go to the next one. No, it doesn't. All right, forget about it. It's all right, unless anyone has extra questions about that. But the idea, again, is that if we think about a female, two X chromosomes, it is mainly only one X chromosome that is essentially primarily used. I don't know if used is really the best word, but. All right, so like I said, I may think about putting these questions up on Moodle in some form. But again, they're in the textbook and you can get the answers from the back of the book. So putting it up as an assignment doesn't really make sense because people may just look up the answers and then not really actually test themselves. But I'll get them to you guys, I guess, in some way. I guess here's a question. How many of you, and it's hard for me to, well, let me see. Let me stop my share. You guys, you can raise your hand and tell me how many of you guys have the textbook. Keep your hand up. Keep your hand up if you have the textbook. All right, so a lot of you guys do have the textbook, okay? Again, to your benefit, I think I told you guys this in the beginning to get that textbook. So you guys have access to those questions. And how many of you guys, who purchased the MyLab? Anyone purchased that part of the textbook? I think it's kind of like an extra part. Raise your hand if you have that and you looked at that. Anyone? No, really? Okay, all right. So what I may do, actually, what might make more sense is actually pull some of those NCLEX, those extra NCLEX questions that they have there and see if I can get those guys to you, okay? I'll see if I want you guys to have some of those practice questions to use if you want, all right? So, so anyway, look out for that. I'll probably put them up on Moodle in some sort of form, I guess. I gotta just see what's the sort of most efficient way of me trying to do that, all right? Other questions, guys? All right, let me go back. What happened here? All right, let me just go back to Moodle. This is so annoying. All right. So our next chapter is chapter 3, like I mentioned. Chapter 3 is just to guide and give you guys a little bit of an introduction. And like I said, I'll have that up by Friday. I'll also have chapter 4 up by Monday. Okay, so you'll have that full week, you know, to look at it. So I will say for right now, if you haven't already, I'll remind you again, it's your responsibility to listen to those recorded lectures, and we should be taking notes in that review sheet. Remember, we kind of started that for chapter 1. Your notes should be there for chapter 2 as well. I told you we're not going to meet on Monday live. I may ask you guys to submit a picture of your completed review sheet thus far. I will also ask for it again before the exam, but the more I'm thinking about it, it's probably best if I'm sort of checking along the way, okay? Again, best to do these in pieces, and then that way if questions come up, you have time to ask them. If you wait until the last minute to study all of this, there's no time to ask questions, and it's harder for that information to digest. Okay, so be on the lookout for that. Like I said, I'll email you guys. I'll tell you exactly what you need to do or what you need to show me for Monday. But there will be something. Okay. Also, I will be putting up an assignment for another journal article. Remember, I told you that journal article that had to do with host genetics and COVID. I will put that up, and I'll ask you guys specific questions in the assignment that you can answer, okay? So I don't think it's something that's going to be a crazy, take you a ton of time. And then probably I won't give you another journal article until after our first exam, and then we'll start talking about our group projects from there, okay? So again, just really keep up on that material. Be filling out that review sheet. I will ask you to show me your progress on that through chapter 2 at least, probably for Monday, okay? And then what else did I want to tell you guys? So again, we won't meet live on Monday. Wednesday, those of you who wish to be in person, we will be in person. I will also let you know exactly where we're meeting. Apparently they don't have that solidified right now, so I don't want to tell you something and then it changes, makes things all confusing. Okay, so I'll be giving you guys an update like I usually do. Usually every Thursday or Friday, I'll always send out an announcement to tell you guys, here's what's due, here's where we're at, any kind of information. So kind of always be on the lookout for that. I just feel like it keeps everyone kind of up to date and informed about what's going on. So like I said, next Wednesday, we'll be taking a quiz on chapters 2 and 3 right at the beginning of class, whether you're live or whether you're remote. We'll then review that quiz. We'll also review the chapter 1 quiz, and then we'll spend time talking about chapter 4, which is stress, okay? And maybe I guess the idea is you're gonna need to be familiar at least a little bit with chapter 4 before class on Wednesday, but either way, I'll make sure we have sufficient time to review that material. So if it seems like for some reason we need more time, I can deal with that. But for right now, our exam is scheduled for Monday, September 14th, and it will cover chapters 1 through 4. It will be about 40 to 50 multiple choice questions, some of them worded in the way of those review questions that we went over, okay? Some might be kind of straightforward recall questions like from the quiz, but a lot of them will be worded in the way that I just showed you guys. And then there will be a couple essay questions on there. Most likely ones that sort of pertain to the case studies or something like that, okay? All right, guys, so we're good for today. Like I said, spend some more time with that chapter 2 lecture, okay? And then be on the lookout for chapter 3. If you have any other questions or you want me to go over anything else from chapter 2, I'll stay on. I'm more than happy to keep answering questions, okay? But if you don't have any other questions, you want to go listen to the lecture, by all means, go ahead.
So for next week's class, I just want to make sure I know everything down. So we'll have obviously